Thanks, folks. It's late in the afternoon, and I know everybody wants to get out. I'm assuming it's still sunny out there, so I want to get out and see a bit of it too. So some very few updates for us, and I'm just going to have to turn around to read this because I'm really struggling now. A couple of dates for the diary. Some will be relevant to thanks whoever heard that. 31st of May is specialty costing returns, so please get those into Mary and the team. Maybe I do need to stand up on that. May and early June, deep dives are kicking off. We've had a few conversations on those today. If they haven't been scheduled, please have the conversation around in the sites. They've already been chosen. 27th and 29th of May, Lorna has already mentioned those, the outpatient clinic mapping workshops, and then we're moving into that mapping and maintenance phases on that. 31st of July is when we're hoping to have that completed. 31st of August is going to be the closing date for the ABF consultation period, which I'll just mention in a minute. And 30th of September is the date that we'll cut off for any patient level costing date to be included in this year's pricing round for 2026. Just to say, the ABF price list is there it should be on hpo.ie at the moment. If not, it'll be there very soon, but it is published. It's also available on ABF monthly reporting if anybody wants to have a look at that. The pricing framework, which really just sets out the principles and the approach for setting the prices, is also available, electronic format only, and available at hpo.ie. Consultation paper on the 2026 pricing framework. We've done this for the last few years where we have opened a consultation that people can have input into the prices. We haven't had a huge amount of input into those, but I would really encourage people. There are only 4 items on there, and the last one, the ABF for productivity, where I spoke earlier on about what other ABF mechanisms we can use alongside benchmarking. I really want to hear your own thoughts of what could be useful to put into that space. We do have to put a report. We've been asked to put that together by September, and I would really love to have a section in there that has the feedback of your ideas that we could bring in there and move it forward. And then just the last one, if anybody really can't sleep at night, there's the pricing model technical specifications. A right riveting one if you have any loved ones when it comes to Christmas next year. This is the one everybody will want. So that's just it from the slides. Just before I hand over to Sarah, just to kick us all out and finish things off, I just have a couple of thank yous, if that's okay. Mm-hmm. I'd like to say thank you to Aoife and Brian and the HPO team who have been running ragged for the last few days and around here today getting everything organised. Thanks so much to you all. I want to say thanks to Christopher Ryan, who has been working with us and touching back and forth for the last number of weeks, pulling the whole content together. I think it's been a really great day, an excellent conference, loads of great discussion and content from everybody. Big thank you to the Hibernia staff. It's an absolutely lovely venue. Everybody's been so helpful, run like clockwork, so we really appreciate you guys, particularly for the short-sightedness, getting that get up for me. A couple of thank yous then for just the participants. Christina, thank you so much for coming over to us. Christina got an invite at fairly short notice. And is going back to Estonia today via her 9th and 10th flights over the last 2 weeks, I think. She did a Nord DRG school over the last week as well, so really appreciate that. And also to Louise, Trish, Robert and Christopher again for the absolutely indecently short notice that we gave them to participate in the panels. Yourselves for staying here this long. That's what makes the day. We really wanted to have much more discussion, panel discussion and input from the audience, so really thank you. That's what made the day. The questions were really good and a lot of participation. And then Sarah, thanks so much. It's been really good. The questions have been really good. kept everything flowing well, keeping us on time, keeping manners, and asking some really good questions along the way, and actually making us feel less nervous than we're probably feeling on the inside. So thanks so much.
Thank you. It's been a pleasure. Thank you very, very much.